Here's what to expect with the sudden and abrupt announcement yesterday from the president that, take a look, Biden is going to be ending the COVID health emergency declaration in May of 2023. And a lot of people wondering now, what does this mean for Social Security, Medicare, Medicaid, stimulus, all the provisions and benefits that have been going out? What can we expect? And yes, make no mistake, this is going to have huge implications. And take a look at all the articles rolling out. The White House plans to end COVID emergency declaration in May. Here are three things the end of the COVID public health emergency could undo. Here's another one. These benefits will disappear when Biden ends the COVID national and public health emergencies in May. And a lot of people wondering, what does this mean for stimulus checks, and the excess funds of $500 billion still just sitting there from previous stimulus packages, untouched, unused. Well, you guys, I'm going to be covering all the details. I'm going to cite the sources, link them in the description below, put them on the screen, read right from them so you know it's the latest. And if you appreciate that, smash the like button, hit subscribe to stay up to date. I'm going to let you know what you can expect. Now, also, before we dive in, though, I want to do something that I normally do not do, and that is I want to share with you my personal opinion about this. And it's just opinion. Take it with a grain of salt. You can agree, you can disagree, but the purpose of this channel is to help people with information so that way you can know what to expect for you and your family, any way to help. And my personal opinion on this is that this could be the end of the emergency declaration officially and finally. And here's why. Two main reasons. The first one being, they said they were going to give us a 60-day notice. This aligns with even more than that. So they have thought this out, and they're thinking that this probably will be the end. That means a lot for some of the benefits and the funding. Now, in addition to that, when this first all unfolded back in March of 2020, we went into that 40-day lockdown, and it continued on. One of the first things I did was, let's take a look at the last pandemic that hit and what unfolded, and let's see if history repeats itself this time. And it looks like it is repeating itself almost identically. It was the Spanish flu, as you will recall, at the turn of the 1900s. And what happened was it lasted for about 2 to 3 years, roughly. The virus kept mutating until it became more and more contagious, but less and less deadly. Never went away. It just became the flu that we have today. And now here we are about 3 years later, and it is mutated to where it's even more contagious, but less deadly. And I think that with that being said, this could be the end. Now, I could be totally wrong, but I just want to make sure that you guys are aware of the fact not to count on this potentially getting extended out again. We need to make preparations for this coming to an end and on a lot of those benefits. Now, what does that mean? Well, a lot of people are saying, yes, it's time for it to end. Others saying, no, it should not be ending. We still have the pandemic going on. Some others saying it's a lot less deadly. And a lot of people saying none of that even matters. Really what it's about right now is the economic devastation that has unfolded as a result of the pandemic, and there's still people hurting financially. We've got 40-year high inflation, interest rates are skyrocketing, we're in the middle of a recession, and there's a lot of pain coming economically, and now we're going to pull the rug out from underneath people with these benefits. You guys, even though this is going to be ending in May, very likely, it does not mean that it's going to be an end for the economic devastation. I'm going to keep you guys up to date so that way you know about everything that's unfolding and what to expect for you and your family. But that's the end of my opinion. Let's get to the facts, and let's go ahead and get you caught up on this new, abrupt, sudden announcement from the president that the public health emergency for COVID-19, the pandemic, is officially going to be coming to an end here in just a few months. So here are three things the end of the COVID public health emergency could undo, and this is linked in the description below. Of course, just came out last night, and also this is going to mean a lot for funding that's going to be available for the pandemic. Now, they're going to be covering in this article Title 42, Medicare and Medicaid benefits, and the federal student loan payment pause, which all they're saying are going to be impacted. Now, the article says that the Biden administration announced on Monday, yesterday, that it plans to end on May 11th a pair of emergency designations implemented during the COVID-19 pandemic. Under both of the national emergency and the public health emergency, both the Trump and Biden administrations implemented and extended programs that aim to provide relief when it came to paying for healthcare, COVID-19 tests and treatments, and making monthly student loan payments. It also included a controversial border program that made it easier to expel foreign nationals, citing public health protections amid the pandemic. The future of some of those programs are now tied up in court battles. The Biden administration announcement came on the eve of the planned vote on the bill backed by House Republicans dubbed the Pandemic is Over Act that would end the public health emergency on the same day the bill, which would still need a Senate vote and President Biden's signature, is enacted. Here are three things that could be undone with the lifting of the national and public health emergencies. The first is Title 42. Title 42 is a policy implemented by the Trump administration that allowed Border Patrol officials to expel foreign nationals at the border, citing public health protections related to the pandemic. The policy, which disregarded and ultimately gutted the asylum system, has resulted in nearly 2.5 million encounters since its implementation in 2020, according to the U.S. Customs and Border Protection data. The Biden administration, since taking over in January of 2021, had continued to implement the policy until the matter became tied up legally. The case made its way up to the Supreme Court that in December reversed an order from a federal judge who ruled the border policy must end. A date has been set for an oral argument in March, with a final decision expected in June, a month after the planned May 11th lift of the public health emergency. In a statement on Monday, the Office of Management and Budget said that the Biden administration supports an orderly, predictable wind down of Title 42 with sufficient time to put alternative policies in place. The Department of Homeland Security has previously indicated that it is preparing to terminate Title 42 once the public health emergency has come to an end. Next, Medicare and Medicaid beneficiary benefits. Since the public health emergency, or the PHE declaration, government programs such as Medicaid were able to operate under special conditions, allowing beneficiaries to retain their coverage during the pandemic. So, if you're one of these people, please understand that this could be impacting your benefits. Medicaid announced a series of guidelines last year on how to return to pre-pandemic norms, stating that Medicaid and Children's Health Insurance Program agencies will be allowed to begin their unwinding period either 1 month before the PHE ends, the same month that it ends, or the month after it ends. Under the public health emergency, beneficiaries enrolled in traditional Medicare and Medicaid Advantage could also receive a free at-home COVID-19 testing and treatments and pay no cost sharing. It also required private insurance companies to cover the cost of COVID-19 testing. With the end of the public health emergency, Americans will need to start paying COVID-19 tests, treatments such as Paxlovid, with insurance companies and manufacturers setting the price. So this is going to be impacting those. And federal student loan payment pause. Student loan payments on debt serviced by the U.S. Department of Education have been on pause since March of 2020, with such loans also collecting no interest for nearly 3 years. But the lifting of the national emergency, which was used as the basis for allowing payments to be paused, could further complicate another Trump-era matter that is now tied up in the legal system. The pause, which has been extended under both the Trump and Biden administration 6 times, is now tied to student debt forgiveness programs that the Biden administration is arguing at the Supreme Court level. The Department of Education said previously that until it can implement the debt relief program, student loan payments would be paused until no later than June 30th, which has left borrowers feeling in limbo. So yes, student loans, Medicaid, Medicare, a lot of the benefits and provisions are coming to an end. I've let you guys know about the food and SNAP benefits, the emergency allotments, the pandemic EBT. Those are coming to an end as well. And a lot of people are wondering, what about the stimulus funds that are left over and stimulus checks? Well, I've let you guys know here on the channel, stimulus checks, we had 3 of them throughout the course of the pandemic, but they're not tied directly to the pandemic. We have had them before in the past with previous recessions, and we're hearing they still could come about in the upcoming recession, which a lot of people are saying is happening right now. And maybe those funds that are just sitting there, $500 billion worth of pandemic funds, could be used to go out to help people in this recession. Now, we will see what Congress decides to do with it. It might be reallocated or redistributed to something else. I don't know. I hope that it goes out for its original purpose and intention, which is to help out the American people. We will see. I will keep you guys up to date. Now, in addition to that, there are still refunds, stimulus provisions, excess budgets providing funding for people. And as you guys know, I have a comprehensive list at www.reliefroadmap.com to keep you up to date on all of the different ones, over 100 different ones for states, cities, and counties that are available for you and your family. Now, regardless of what unfolds, I'll keep you guys up to date so that way you know what's going on. And also, Social Security, as you know, there is a lot happening with it, and right now 2023 is shaping up to be the year of Social Security reform, and we just heard from the president and Kevin McCarthy that the program is going to be strengthened. They want to enhance it, they want to change it, they want to make big impacts that are actually going to benefit it. And this comes after weeks of hearing there could be potential cuts to funding. But you guys, it all has flipped. I will keep you up to date on everything. And if you want to get the latest on Social Security, check out this video next. Just covered the details for you yesterday as it came out over the weekend. And as more unfolds, I'll keep you guys up to date. But please prepare you and your family for all of these benefits as a result of the pandemic could be coming to an end in 2023 in May. But with that being said, you guys, thank you so much for joining me. If you made it this far, haven't already, smash the like button. If you appreciate the updates, subscribe to stay up to date. And with that being said, I'll catch you in the next one. Take care. God bless. This is Steve.